Now, let's understand the causes that lead to the hypothyroidism. Lymphocytic thyroiditis and idiopathic thyroid gland atrophy are the most common etiology that result into the hypothyroidism. In that, first is a lymphocytic thyroiditis, meaning it is an autoimmune inflammation of the thyroid gland. This condition is immune-mediated disease, meaning the immune system decides that thyroid gland is foreign to the body, and it produces the lymphocyte as an antibody against the thyroid gland, and it attacks the thyroid gland and result into the inflammation. That's how it named a lymphocytic thyroiditis. Second one is a idiopathic thyroid gland atrophy, meaning shrinkage of thyroid gland occur and normal thyroid tissue is replaced by the fat tissue. If we break down this term, idiopathic means the disease occurs spontaneously without any reason, and atrophy means decrease in the size of cell or organ. There are two types of hypothyroidism. First one is a primary hypothyroidism. It is the most common form in the adult dogs. There are few causes that related to the primary hypothyroidism. They are lymphocytic thyroiditis, idiopathic thyroid atrophy, thyroid neoplasia, iatrogenic hypothyroidism, meaning when the treatment for the hyperthyroidism causes the suppression of the total thyroxine hormone, that is the T4, below the normal level, it results into the iatrogenic hypothyroidism. Primary hypothyroidism, also known as thyroidal hypothyroidism, because most of the causes are related to the thyroid gland. Moreover, lymphocytic thyroiditis and idiopathic thyroid gland atrophy, these two causes are responsible for more than 95% cases of the hypothyroidism. Second one is a secondary hypothyroidism. This type of hypothyroidism occurs due to the inability of pituitary gland to secrete the TSH, causing the thyroid tissue atrophy, pituitary neoplasia, pituitary cyst, pituitary destruction, pituitary malformation. These are the causes for the secondary hypothyroidism. And secondary hypothyroidism, also known as pituitary hypothyroidism, as most of the causes are related to the pituitary gland. And secondary hypothyroidism is responsible for less than 5% cases of the hypothyroidism.